Hello, this is Dr. Rahul Desai, and I am going to be talking about what the most successful dentists and orthodontists need to know about photobiomodulation, the science, the simplicity, and the smart integration of this into your practices. I want to thank my family for giving me the time to work on these amazing projects and the understanding of my time away presenting and teaching and learning about this new medicine. So this is my introduction to photobiomodulation about 10 years ago. And it wasn't in a clinic or in the lab setting. It was actually in a performance and wellness center that opened up across the street. And they put in a $150,000 red light bed. I joined, membership. They had PEMF and some other modalities. And I really felt the effects almost immediately. I had better sleep, less pain, reduced anxiety, and overall just a general sense of wellness after a 10 or 15-minute session in the bed. But here's the catch. After my initial excitement, I just couldn't keep it up. Like everyone else with the subscription-based health service, the routine was just too hard to maintain. The scheduling, the commute, the extra time it took to get there just really wore me down, and my visits became less frequent. And as frequency dropped, so did the results. At first, I thought it was maybe the therapy itself wasn't effective as what I'd hoped, but I realized, especially after years of time passing, using it as a physician and using it as a patient, that the medicine is legitimate and amazing. It's the dosing pattern that wasn't proper. Uh, Over the years, as a regenerative medicine doctor, I leveraged energy-based medicine in its various forms, like shockwave therapy here. We had a couple of stores units. We had an M-Sculpt Neo for building muscle, activation, losing fat body mass. We also had a PEMF device that was helpful in healing, and reducing inflammation, improving muscle tone and activation. And we didn't buy a red light bed. It was expensive. The ROI wasn't there, and it was a little challenging just for space as well. I had one of my longtime patients and now an owner of Redvive came to me several years ago and asked me about using a portable panel. He said, "Doc, you got to try this." And he's a biohacker himself, very knowledgeable about all different forms of medicine, stem cells, energy-based medicine. And so, I listened to what he had to say. I was still skeptical. I said, this is a $2,000, $2,500 panel or $1,000 panel. How could it be as effective as something that is going to, cost $150,000? But he said, "Hey, doc, take this home, try it." And I took it home and I started using it. And I felt amazing. Even after a single use, my low back pain, which I targeted, felt a lot better, felt more mobile, less inflammation, and just overall felt really good. And the intensity of the light, it also felt adequate or even more so than what I'd experienced in the bed. And my family started to use it. They liked it as well. And it was really interesting. We started to sleep better. We actually had it in our living room, used it for about a month, and went back to him and talked to him and said, "Okay, this is really interesting. Let me try it with a few patients." We put it into the clinic and started using it. Had a couple of cases that went, extraordinarily well with really fast healing, and surpassed my expectations. And I said, "Okay, this is super interesting. If I'm going to be part of this company, which they asked me to be, I said, I need to understand this more fully." I started looking at every book, podcast, read through stuff, a couple of months of really educating myself and getting a better understanding, but there was a gap. And so I joined the World Academy of Light Therapy. It's an organization at the time. I think it changed its name now, but I went to their international Congress. It was in London. I asked, the team to send me over there. And for a week, I spent, in a deep dive. There was 153 lectures from folks all over the world. It was pretty amazing. And the breadth and depth of the information was just outstanding. You can see here, this is the table of contents, and you have, from neurorehabilitation to metabolic autoimmune disease, bone, musculoskeletal, acupuncture, wound care, dentistry, oral care, pain management, addiction medicine, dermatology, sports medicine, ophthalmology, aesthetics. I mean, everything was covered there. And it was thousands of people and super interesting deep dives. I got to meet professors and scientists from all over the world, from Harvard, Cambridge, South Africa, Asia. And when I came out of it was with some really deep insights that this panel that we had the right medicine, had the red light and red infrared light was actually medicine. It provided a medicinal effect on our tissues. And number two, that we were getting the adequate uh, medicine in the wavelengths, if you pick those right wavelengths. And then with an LED, you were able to get the adequate power to fuel the cells. And so coming back with that knowledge, I was even more excited about implementing this. This is one of those sentinel cases that just showed the power of it. And this was a professional horse rider that got kicked in her knee, had a complete ACL tear, MCL, and dislocated her patella. You can see here the MRIs. They were going to have three separate surgeries. It's done at the same time, but three areas. By 18 months of recovery, very invasive surgery where they're going to, reconstruct, put holes in the femur and the tibia, reconstruct the ligament, use a lot of anchors and other things for these other tissues that were injured. So she flew out to Portland. They were from Georgia. Flew out to Portland. We did a stem cell procedure, and we leveraged photobiomodulation and leveraged it pretty rigorously and kind of not what was in the literature, like 3 times a week. This was every day, twice a day, and the results were outstanding. So we saw this patient got repeat serial MRIs. They were very interested in what was happening here and because of their profession as well. So we saw that after a few weeks, the ligament had actually started reconnecting, though it was diminutive and somewhat lax. A few weeks later, thicker, a little bit more taut. The medial patellofemoral ligaments were healing. Here's a slice through the ACL. You see it actually is attached and almost perceived the double bundle. And here's 7 months later, completely healed. And that followed clinically. Patient was back to horse riding, no pain, full functionality. We worked very closely with their physical therapist. Her mobility was fantastic. Her stability was fantastic and symmetric with the other knee. So it was outstanding results. And I think due in part to the consistent photobiomodulation use as well. So why does light have this biologic power? We're going to talk a little bit about that. Just innately, it just seems to me initially it just seemed kind of odd. When I dug into it, it's actually beautiful and fascinating. And why specifically red and near infrared light? And why does daily exposure, or why even twice a day exposure, why does that make sense? So evolutionarily, the biology of light is at the source of all of human life and all life on this planet. So every cell from the unicellular organisms from millennia ago, a billion years ago, used light as a form of energy. And every cell in our body and every cell of any organism is a receiver of light, and it translates that light into energy. And so from the first bacteria to modern humans, life has always used photons as information. But why red light? Why near infrared? And what's really fascinating, for 400,000 years, humans have been around, and sunrise and sunset has trained our cells to respond to red and near infrared light. This is a nice depiction of this, is when the sun is at a high angle. So this is high noon, and the sun is beating straight down. The distance that the light has to travel is less through the atmosphere. So there's less scatter. So the high energy waves can get through. These are the ultraviolets and the blues. That's why the sky looks blue in the daytime. At a low angle, so a low sun angle, so about 15 degrees, when does that happen? That happens at 2 times, at sunrise and sunset. When that happens, the light has to travel a much longer distance. And when that happens, the blues, the ultraviolets, those high energy rays get refracted and scattered. And what comes through is the red and near infrared. That's why the sky looks different in the morning and the evening. And so our bodies have been trained for that. And so what happens? What do you need to do when you're crawling out of a cave or crawling out from underneath a tree? Millennia ago, what had to happen? You had to create energy, right? There are certain systemic biologic things that had to happen. And the trigger, before we had light, before we even had fire, the trigger was the sun, right? And that increased ATP production, getting ready for the day, getting out of bed, all those things, they're inherent in our cells. And what's really interesting is that modern data and animal studies have shown that if on a normal circadian pattern, there's increased ATP production when red and near infrared light is illuminated in the morning. The cells produce more ATP than in the evening. So there's a difference. So even though it's receiving the same signal, the same medicine, the way that our bodies process it is different. The same thing in the evening when we get that, see that sunset, there's a trigger in our body that releases more hormones, the right hormones, melatonin, growth hormone, modulates cortisol, and gets us ready for rest and recovery. So there's natural patterns of healing and energizing that occur with this light. So our cells are tuned. So the story, which I find totally fascinating, my story as a physician, I'm a musculoskeletal and interventional functional or regenerative medicine doctor, and part of that is healing. So we used cells over the years, and you know this gentleman here. We invited you to the webinar, so that he helped us build this website years ago. You can see it, this kind of dated with COVID-19 update. And we were using cell therapies, autologous cell therapies, to help heal every orthopedic condition. So from the big toe arthritis to cervical degenerative disc disease to C1-2 degeneration, and even a few cases of TMJ. And we leveraged bone marrow, autologous fat, platelets to help tissues heal. We helped define an industry. I was lucky to be at the right place at the right time and very curious. And so we were early in the field. We had a lot of, because of the radiology background, I took a lot of before and after pictures, and I was super passionate about this. And what we realized with the healthier the body, the better the results. We always want good results. So we're going to heal those tissues like we saw with that ligament. The patient has to be healthy. So we wanted to leverage every single thing we could. And that's where, we came into, regenerative medicine and energy-based medicine. So we were defining this field. I was blessed to be, part of some of the largest nonprofit organizations in the world. I was able to speak and teach at the NIH. And part of that, the learning was the energy-based medicine. And so it was amazing to be able to use that. And so that was my field. So we leveraged it. So any PRP case that I did, we would add a small panel. Any stem cell procedure, we had a large panel. And that was because I was so passionate about driving this. And that was in the last year of my practice. It was to generate that energy, generate that healing. And we'll talk a little bit more about that. Apply this medicine to stimulate even systemic healing. So it's pretty amazing that we could get all of these results for such a simple tool. And it was something that the patients could take home. And that was the difference. That they took it home, they used it twice a day, and hopefully now you understand you're getting this energy, you're getting this signal. Why use it twice a day? Well, sunrise and sunset, like stimulate those tissues. And there's different protocols and different ways that you can leverage this, but that seems to be one of the most consistent and easy patterns, and it matches nature, which is totally fascinating. And my story as a patient, unfortunately, I have hyperlaxity syndrome, EDS, and have had to have about 18 PRP and stem cell injections. Unfortunately, these images are of me. So this was a horrific tear of my Achilles tendon, about 90%. You can see all of this white is a tear, and the tendon is barely hanging on. We use stem cells and photobiomodulation to completely heal it. Never had to have surgery, and super strong, and the tendon feels better than the other side most of the time. So it's pretty amazing that was bone marrow fat and platelets like you saw before with that ACL. And I've had that same material placed in my disc. I had a 4 or 5 disc herniation. And this was before we were using photobiomodulation. But just to tell you, I've had, plenty of musculoskeletal injuries and the need for healing. I had always been in pain, even after these, procedures. There was some aches or pains, some hyperlaxity, some instabilities, especially my low back, my SI joints. And photobiomodulation completely changed that. And it was this daily, consistent use that was the game changer. This is me a couple of years ago. So this is a person that is inflamed, overweight, in constant inflammation. And I had lost functional confidence. I was afraid to move. There were times when simple things like opening a door, I would sublux my shoulder or wrist. I tried to work out, and I would never be able to get strong enough to do any significant weights because of injuries. And it was really, really frustrating. I had used red light before, like I said, and even in these pictures, I'd been using it, but I wasn't using it the right way, right? It's like just an analogy. If you were taking Advil and you took 1 milligram of Advil and expected to not have your headache. It's not going to work, right? The dose was off. So I started using this at home, and I did not have this intention. I started using it every day, and started using it as more and more I learned about it. And I was like, oh, let's try this twice a day protocol, twice a day microdoses, 7 to 10 minutes, AM, PM, and then areas if they're sore or achy or working out, I would use them in those regions too. And it became very consistent. I even used it on my brain for anxiety and stress, as we all have. I have 5 children and a big family and lots of work stresses. And so, you always have these things. So that's another way that I leverage that. And the neurocognitive improvements that we're seeing in the studies is really, really fascinating as well. And so what happened? So after about 6 months, I started feeling amazing. I was like, I have no pain. I'm super strong. I'm lifting more than I've ever lifted at 50 years old. And my body just started to change and morph. And my next picture, some of my friends tease me, it's my OnlyFans picture, but this is me today. And so from pain to performance, what daily dosing can really do. So from Ehlers-Danlos instability, chronic pain, I had no change except in the training and the supplementation, only light. Now I was able to do more over time with the training for sure. And it was very synergistic. And this is not about just a cosmetic transformation. This is biologic. This is not about vanity. This is about cellular adaptation. It's not about aesthetics. That's a nice side benefit, but the functionality, the lack of pain, the ability to move and be part of my family's life is much more important than that. So when you live the data, you no longer really have to sell it. So that's my story as a human being, and something that I'd like for you all to experience because I am so passionate about it. So what does PBM or photobiomodulation stand for? It's using the specific wavelengths in the red and near infrared spectra to affect and modulate biologic systems. So what we're doing here with this specific medicine, we'll talk about this electromagnetic spectrum. It's vast, right? But we're using a really small snippet of that to stimulate mitochondria and power the cells and promote healing. So if you look at this is the electromagnetic spectrum from gamma rays to AM radio waves. And a small snippet is this visible spectrum from about 380 to 750 nanometers. And what we're talking about is even a smaller area, just in the red and near infrared zone. Here's the visible spectrum, and we're talking about this right here. And so from 600 to about 900 nanometers. Why? Why is that important? Those specific wavelengths hit the body, hit the tissue, hit receptors in the tissue, hit receptors in the eye, and elicit a very specific change. The other wavelengths do not do that. Right? If you get into the mid-infrared and far infrared, their target's different. Right? Our target, and we'll talk about that, is cytochrome C oxidase in the mitochondria to produce more energy and a biologic effect and cascade. When you move to these different wavelengths, they have different effects. They're not good or bad. They're different. So in the infrared spectrum, when you move to above 900, it targets water and it heats it. So there's really good thermal benefit. So you can heat tissue, you can have it in saunas, you can have detoxification, better vasodilation, blood flow, heat shock protein production, all kinds of good stuff. But it's not the type of photobiomodulation that we're talking about with mitochondrial activation. That only comes from cytochrome C oxidase activation. So there's lots of light sponges in our tissue, hemoglobin, melanin, water, and these opsins, cytochrome C oxidase, and there's also opsins in the eye, in the retina. And that's what these specific wavelengths, 600 to 900, or 600 to 800s, that's what that's focusing on. So that's the specific medicine. So we have the right medicine in our devices, and we're going to deliver it in the right way. And the two pathways into our body is into eyes and into the tissues. We do not sell tinctures of this, just to be clear. This is just a representation that this is medicine. Right? If you think of it that way, it makes things a lot easier. So this medicine, when delivered in very specific ways, excites cytochrome C oxidase. When that happens, it releases nitric oxide. That's the first part of this cascade. There's lots of benefits to more nitric oxide in the cell and in the tissues and the bloodstream. Vasodilation, inflammation reduction, better blood flow. ATP production is the second part. So when nitric oxide is displaced, oxygen then binds to the cytochrome C oxidase, and it's a transmembrane protein in the mitochondria. And ATP is produced in much higher levels. So instead of 2 per cycle of the electron transport chain, there's 32 ATP produced. So up to a 16-fold increase in intracellular ATP. That's the currency of the cell. So every cell is able to process better, move things better, heal, remove toxins, all the good things. So that's one thing. Another thing that happens is gene activation. Through a burst of reactive oxygen species, the nucleus gets stimulated and he pushes it into an anabolic phase. So there's gene activation, and this stimulates long-term healing and even stem cell activation. So that's kind of this cascade. So we'll go through it real quickly again, because this is the deep science. Light, specific wavelengths, hits this transmembrane protein, cytochrome C oxidase. Nitric oxide is released. Good things happen. Oxygen binds. Even better things happen. More ATP is produced and energy rises. This electron transport chain and these pumps start to work a lot better, and much more ATP, up to 16-fold from the lower energy nitric oxide bound state, is produced. A reactive oxygen species burst. It's a hormetic effect. It stresses the cell for a brief moment. It changes the way the nucleus is behaving. Master genes awake, and stem cells get activated. They go into the bloodstream, and they start homing in on areas of injury. And so that's a stimulus. And this is another depiction of that in one place. When patients ask me, or doctors ask me, and we need to make this as simple as possible, this is kind of my holy trinity of photobiomodulation or red light therapy. So what happens? One is performance. So mitochondria get stimulated, the cytochrome C oxidase pathway, ATP production, right, and all those cellular activities. So performance is improved, energy. Number two, TRPV1 receptors are very sensitive to red and near-infrared light. So when you shine light on those nerves, and TRPV1 receptors are capsaicin receptors, they're pain receptors on nerve cells, and they produce nerve inflammation and pain and are intimately associated with neuropathic pain. When you stimulate or modulate them, they downregulate with light and they stop producing those pain signals. If you continue to do that, so it works immediately as an analgesic, but if you continue to dose, especially on this dosing pattern, once a day, twice a day, and consistently, the nerves can actually heal. You reduce long-term neural inflammation and you allow the nerve to heal and regenerate. And lastly, there's stem cell regeneration. So all these work in concert, but when you have this stimulus, they've done studies where even short periods of illumination or radiation with red and near-infrared light stimulate stem cell activities. So they actually leave their stem cell niches in the bone marrow. They leave the areas, they're in the around the vessels, around fat. They're called pericytes. They crawl into the vessels and they're activated. And so they can start healing both locally and systemically. So there's a large systemic effect. So this is a powerful biologic amplifier, right? And that's what we're seeing with photobiomodulation. These are some slides that you can look at that kind of go through these processes. These are all from papers. Here's TRPV1 receptor modulation, reducing pain, improving analgesia. And that's why some of the patients, even after 2 or 3 minutes of exposure to light, will feel better. It's not like magically fixing things, but it could be very well tied to the TRPV1 modulation, potentially some nitric oxide release and vasodilation. But it's a pretty amazing effect as to how quickly this can help with pain and discomfort. Photobiomodulation therapy for bone marrow stimulation. This was another study that was fascinating where they irradiated the tibia for 15 minutes. Before they did that, they measured blood, they did venipuncture and looked at CD34 cells in the bloodstream and macrophage numbers. They stimulated for 15 minutes, and then 2 hours later, and then every day for 4 days, they measured these levels, and they noticed on average a 300% increase in circulating stem cells and a 1,000% increase in macrophage activity. And that lasted anywhere from a day to 4 days. So there was some trailing effect. But this is that systemic boost that we see, and this is some of the mechanisms where they feel like even illuminating the abdomen is helping in Parkinson's disease, Alzheimer's, neurocognitive decline, dementia, because there's systemic benefits. And we saw the same when we're using this for musculoskeletal issues and even in dental issues, that you can stimulate the body. It just doesn't have to be over that oral cavity to get these healing benefits. And then stem cell activation outside of the body. So when we're doing regenerative medicine, what about the cells in the test tube before you inject? Can you activate them? Can you stimulate them? Can you get them turbocharged? You can. And that's called ex vivo photobiomodulation, so outside of the body. And there's plenty of studies out there that are showing there's improved viability of stem cells. The cells are demonstrating better energy metabolism, improvement in growth factors, better differentiation, adhesion. So all of these improvements in the cell, the way the cells are responding, is pretty fascinating. And it's a very short stint because they're within a clear test tube. So if you illuminate them, you only need usually 60 to 90 seconds for ex vivo stimulation. So you don't have, it doesn't affect workflow if you're doing PRP injections or PRF injections, or even for bone grafts and other tissues. This can be really effective. Here's another, some studies demonstrating the power of infrared on stem cell activation. So what influences dose? We talked about that, hey, this is the medicine. What about the dose? So the dose is really important as far as getting the right effects. So dose is a combination of power, the distance, how far away you are from the device, and then how long you sit in front of that device. And that's how much energy is getting deposited into the tissues. And we measure that in a term called fluence. And that's joules per centimeter squared of the tissue that's being illuminated or irradiated. The easy way to think about it, I like analogies. So one way to think about this, because it's somewhat challenging if you're not used to it, is a waterfall. Okay, that's my analogy. So this is a waterfall of light, and that's energy that's coming down. Here's the top of the waterfall, it's flowing, and then it hits the basin. Irradiance, which you will hear a lot, the power of the bulb or the power of the device, is basically the flow rate. Okay, like how much of the energy is coming down, and the flow rate at the skin, how strong is the light when it hits the skin, is the irradiance. And the irradiance, or how, depending on where you're measuring it, the irradiance can be measured at the source of the light, 3 inches away, 6 inches away. So that's the important, like how much of the flow rate are we seeing? The fluence, which you talked about, joules per centimeter squared, is how much is collecting in the target tissue, in the basin. And that's the total energy deposited into the tissue. And that's a very important factor because different injuries, different indications require different amounts of medicine, right? Just like if you were taking an Advil, that you need different amounts for different things. If you have a very mild headache, maybe 200 milligrams is okay. If you have a severe injury, a post-operative, you may need 600, 800 milligrams, right? So it depends on the thing you're treating. And that's the fluence. What is the attenuation? That's the splash, the mist, the evaporation. What's energy is lost in the skin and in fat and scatter. And so that's kind of all the waterfall. Like you're going to lose energy. The farther you are away, you're going to lose more and more energy. A term that's important is Monte Carlo dosimetry. These are computer models that track all these photons, these droplets, how much actually makes it into the basin. And then the therapeutic window is the water level in this lake or in this basin. We want it just right. Too much, no, or too little, no effect. If it's too much, it's actually inhibitory, like you're flooding the tissues, nothing's going to grow or heal. And so we really want to achieve this kind of harmony. And that's the art of the medicine, that you have this pure, clean energy, so the right wavelengths. We talked about 630, 670, 810, 850. Those are the ones. Those are the right energy wavelengths. And then so that's the right medicine. You want the right dose, right? So we want the right amount of water. We want that clean, fresh water. We don't want salt water. We want fresh water coming down into this basin. And we want to hit the therapeutic window. So we want to have the right amount of water here. If we have too much, it's going to flood. If we have too little, everything's going to dry up. So we want that just sweet spot, that right amount. And so the dosing parameters are wavelength, intensity, distance, time, frequency, and the interval. If the body needs to respond, so it takes about 24 hours to 48 hours if you illuminate tissue for there to be a response. If you do too much, what happens? You get this stimulation, and then you get this inhibitory response. So if patients are feeling really good because the analgesia is working and they're continuously doing it, it could be a problem. It could be a problem. And so then we'll get into this flood zone. Nothing's growing. And so there is a sweet spot. This is called an Arndt-Schultz curve. We want to have, it's kind of like the three bears curve. So we want it just right? So too little, it's insufficient stimulation. Optimal, just right, positive effects, improvement in cell healing and activity, reduce inflammation. Too high of a dose, it's going to inhibit the benefits. So does this work? Yes. And does it work outside of the mouth? Yes. Can the energy from this external source get into the oral mucosa, get into the periodontal tissues? Yes. And so the nice thing is this is actually a insurance covered procedure for a specific indication. That's oral mucositis. That's the first indication that was covered by the insurance. And that's for patients that either before they have cancer therapy or afterwards, if they develop oral ulcerations or oral mucositis, this is the gold standard for treatment. And that can be intraoral, it's almost like this popsicle device, or extraoral. So these are LEDs, and they have some low-level light lasers as well, but they're basically delivering that energy through the tissues, and enough energy is getting to our target tissue to make a benefit and heal. And so they did the studies both clinically, the patients are doing better. You can see the studies down here, and these are LED, so light emitting diode. That's the types of energy source that we have in our Red 5 panels. And they did this Monte Carlo dosimetry to demonstrate that enough energy was getting deposited, and they were equivalent results to diode lasers. And they had benefit for oral mucositis and head and neck cancers. So it's not the peak energy that's important. It's the total energy, right? Total energy, not peak power, drives the biology. So a 2-minute session with a laser, you might have 3 to 6 joules per centimeter squared of fluence. And if it's once a week, that's what you're getting. With a Red Vibe session, we're able to deliver 2 to 3 joules in a 10 to 15-minute session, and you can do it twice a day. So now you're looking at 40 to 60 joules per centimeter squared in a week. So there's a massive compounding effect. You're putting a little way in the bank every single day. And it's beautiful because it's safe. It's a class 2 medical device. It can go home with the patient. It's very hard to cause damage. There's no worry about thermal injury or burns. So it's really physiologically smarter and just tactically smarter. So the dose, density, and the frequency, you're getting that on a continuous basis, and there's cumulative benefit. You're getting systemic coverage. So laser is very pinpoint. LED is broad spectrum. So you're going to get a much bigger area of systemic coverage, local coverage, but then you'll also get a more profound systemic stimulation. And the total photon delivery over time is going to be much higher. And it is the depth of the LED reaches around the same depth as a laser, and that's been proven by many studies. So healing responds again to this total energy. So over time, we're going to outpace the lasers because of the dosing pattern. And if the patient was able to take the laser home and use it twice a day, then we're talking about equivalent or more exposure. But that's just not the case currently. So it's so simple, so powerful. It fits naturally with your treatments. You can use it wherever biology is stressed, right? So if that is in orthodontics, with adjustments, with aligners, with other general dentistry applications, think of inflammation, pain, tissue is stressed. This is going to help things heal better, faster, stronger. And the application is so simple: twice daily, ideally AM, PM. You can localize the treatment to the mouth and face, and it's invisible efficiency. You're going to start to see these benefits, and there's this quiet amplification of the things that you're doing for the patients. So it's a perfect adjunct. And why does it work? We talked about it. Mitochondrial ATP production. It's going to stimulate and help fibroblasts, osteoblasts, osteoclast activity. There's angiogenesis and oxygenation in these compressed tissues. In the ischemic areas, there's going to be improved collagen synthesis and remodeling for faster stabilization. And that's what I experienced in my body over the past couple of years with changes in my collagen and tissue structure. Pain modulation, that's something that they feel right away, which is beautiful. So reduced inflammatory cytokines, nitric oxide mediated vasodilation. And so PBM accelerates tooth movement, reduces pain and inflammation, and promotes tissue recovery between activations. And these are studied. Right? So if you look at the studies out there in general dentistry, there's 2,500 studies on photobiomodulation. There's 500 in orthodontics, and you can see the spike over the past several years. There was a little dip post-COVID, but we're seeing the studies that are out there, and there are specific, not a ton, but that's where you're going to be playing a role in this as well. We want you to be thought leaders here. That the effects of photobiomodulation on tooth movement and hypertrophy, like reducing gingival hypertrophy and improving pain response. You can see these studies are there. So photobiomodulation in orthodontics, mechanisms and clinical efficacy. So I think for braces, for aligners, if you hear me lisping a little bit today, I do have my aligners in, and I've been using this on a daily basis, targeting my mouth. I've improved movement and much less pain, especially when I'm changing my trays. So this is something that's very synonymous. This is kind of a busy slide. I'll let you guys look at this, but we're just translating what we're seeing in the medicine domain, what we're seeing in TMJ. There's an orthodontic analog, and the mechanisms are very similar, right? It's the same. We're working on those cells and all the things that we talked about. Here's how to start tomorrow. Really what I think, with all of the benefits that we see, I'm an evangelist. I think everybody in the world should have a photobiomodulation panel in their home and use it like we talked about. So that might be a little bit too much. But how can you start tomorrow to help your patients? I think patients that are doing aligners, patients that are doing braces, no brainer, right? Use it for TMJ, facial muscle soreness. It's an at-home device. It's super easy, a few minutes a day. And it's really about that patient experience and this biologic harmony. It's going to accelerate. Choosing the right partner. We want to be your partner in this. This is not us selling you a panel and then sayonara. This is a system that you're stepping into with us. And we are going to help you, educate you, and that's part of this lecture, but educate you on this science, leverage it for you, and then teach you how to implement it in the business sense. We have the proven wavelengths, the right dose. We have a regenerative medicine workflows. We built a Red Vibe University, which I'm pretty proud of. And that's going to help you understand the medicine. It has all the PDFs of the articles that are important. And this is both in the dental space and outside of it, because we're going to use this for our general welfare and lives, and even for some of the patients' issues. We make this really simple and safe. We drop ship everything. You have no financial burden. If the patient doesn't like it, they return it to us. We handle all those back end things. So we have a fantastic business model. Photobiomodulation, PBM. It's also photo business modulation. And so we help with that. Both clinical integration, educational, referral paths. We have the Red Vibe University, and we have a proven system. Once you decide to join us, we will have multiple calls. We will walk you through this whole process, and there's a success path, a three-stage path. You experience it, you feel it, your staff feels it, we educate you on it. Once you feel that light, once you feel that benefit, and you will notice it very quickly, almost every single one of our 200 plus affiliates have. Then we teach you how to integrate it, because now you believe in it. You're going to integrate it into your practice. And when you start seeing the results, your patients are going to tell you, eventually you're going to evangelize it. So stage one, we're going to give you a starter package. You're going to implement it into your practices. You'll have meetings with our team on Zoom, on the phone. This is kind of one of the starter packages, experience package, where you get 2 largest panels and then 5 smaller ones. So you can take one home and start using it for you and your family, like we did. And then you have one for the clinic, so patients can get the demo. And these smaller ones can be given to staff, patients, and we want you to just get experience and feedback. For you, as providers and clinics, it's always 50% off. So you get this entire package for about $5,400. Stage 2 is we integrate it with you. So once you know that, hey, I like this, I want to go forward with it, and I understand, we're going to help you identify those procedures that you do, where it fits in your practice and where it can stack, because that's the best way of doing it, is stacking with a procedure. We're going to train your staff, and we're going to get you going. This can have a tremendous benefit, obviously, for your patients, and that's what we talked about with the science, but also for the practices. We see practices that are, adding $100,000 to $250,000 a year to their bottom line, and that's net profit, right? Because there's no inventory that you have to hold. There's no outlay of cash for you. So it's a pretty amazing business model to help get this medicine out there and help your practices, because you have to support your practices financially as well. So there's a 40% margin on every panel and every device or stand that's sold through your clinic, that's automatically sent to your accounts. We have a fantastic tech stack that's been developed from our CEO. And then you evangelize it. So once you get that feedback, we want that social proof, social media. We do a podcast with you. We get this out to your community. And we want you, that's one of my dictums, is to make you the expert in photobiomodulation. So the next steps, purchase an experience package and book a consultation with me and the team. Here are some QR codes. I hope you can join us and join the journey in this revolution of light therapy. I really appreciate your time. Thank you so much.